enter the room.
Hello, I'm Mishi Khan, one of the doctors here in this department. Before we start, may I know your name, please?
Hi, doctor. I'm Emma Smith.
Okay, is it okay if I call you Emma?
Yeah, Emma is fine.
It's nice to see you. Can you please confirm your child's full name and age for me as well?
Yeah, it's Lester Smith, and he's 5 weeks.
Okay, it's good to see you both here. Please tell me, how can I help you?
Doctor, I'm a little worried about the injection vaccination that Lester is supposed to get, the 2-month one basically.
Okay, can you please tell me what exactly is concerning you about the vaccinations?
I'm just really worried that he'll get sick. I've heard this about this particular vaccine that a lot of people are telling me that he gets very sick after that.
Okay, that's really some good valid concerns you have come up with, Emma, and I'm here to help you, not to worry. Uh, so, please tell me, have you read about vaccinations anywhere online?
Yeah, I mean, kind of. I have some, I Googled it.
Mhm. Okay, and do you know the importance of giving vaccination?
Yeah, I know that it's for the immunity.
Okay, and okay, I just want to know a few more things about Lester. So, how is Lester doing at the moment? Is he feeling all okay?
Yeah, he's okay.
Okay. Is he eating and feeding properly?
Yeah, he is.
Okay. And by any chance, does he have any flu-like illnesses or any fever?
Oh no, not really.
Okay, that's good to know. Were there any complications when you were pregnant with him or after his delivery?
No, nothing.
Okay. And apart from Lester, do you have any other children?
No, the
Okay.
only baby actually.
Okay. And okay. And by any chance, are you aware about his, does he have any allergies so far?
No, nothing so far.
Okay. Uh, something about vaccines online on Google. So, apart from that, has anyone told you anything else related to vaccinations that's particularly concerning you?
Yeah, so this the 2-month one, that's it's in another 3 weeks from now. They said it's something called a 6-in-1 vaccine, like
Okay.
6 different things in one vaccine. That's kind of scary. I mean, why can't we give individually? It feels like he's gonna get more sick from it, like a lot of things at once.
I completely understand what you're feeling right now, Emma. Okay, Emma, thank you for having this discussion with me. So let me explain to you what vaccination is, okay? So vaccine is basically they are they contain like very little amount of weakened or inactive bugs that are completely harmless. So what they do is they actually provide immunity to the baby. They boost or they strengthen the child's immunity against the actual infection. Okay, so that whenever if the child is exposed to that infection, your child's body is ready to fight with that infection. So far, are you able to follow me?
Yes, doctor. I mean, I get that, but I also heard that it causes autism.
Okay. The reason I will clear that query of yours as well shortly, Emma. So I just want to explain to you that the importance of giving vaccines are that as you very well understood that they are given to make the to strengthen the child's immune system and to fight against infection. Moreover, if we give vaccines to children, they kind of the entire community somewhat gets protected from that deadly infection. So it's really important for us to give a child vaccine. Your concern about MMR vaccine and causing autism, am I right?
No, this 6-in-1 also I heard can cause autism.
Okay, so let me explain to you that vaccine is something that that fights through infection, and autism is not an infective disease. It's more like a clinical disorder in which a child has some learning disabilities and stuff, but it's completely not related to vaccines at all. It's more like a clinical diagnosis, and vaccines are something which is more related to fighting, in providing child immunity against infections. Is that understandable, Emma?
Yeah, I that I understand. Yeah, but why can't we do
2 minutes
separate?
remaining.
Have to be all 6 at once.
Okay, so let me explain to you. Since right now Lester is 5 weeks old, so within a couple of weeks he will turn 8 weeks, and he will be giving his 6-in-1 vaccination. So you're concerned that he would be given 6 injections in once, but let me clear this. It will be a single injection which fights against 6 infections. Is that clear, Emma?
Okay, yeah, that makes sense.
Yes.
Yeah, that's
So I'll
better.
explain more about this vaccine. So this one single injection will fight against 6 infection, which includes diphtheria, which causes throat infection, tetanus, which is a bacteria that is present in the soil and can affect the nerves. Then there's pertussis, polio, Haemophilus influenza, and hepatitis B. I understand this is a lot to take in, so don't worry. I would be offering you a leaflet so you can read and understand about each and every type of vaccine. And one more thing, apart from the 6-in-1 injection, you would also receive a meningococcal vaccine which protects against meningitis, and also a oral drop which is a rotavirus to this type of virus usually causes severe diarrhea, so it can be prevented by this. So there are certain side effects associated with vaccines. The child can have fever, a bit pain on the injection site, and can be a bit irritable, but they usually settle down within 1 to 2 days. So don't worry, if he has any of these symptoms, we can offer him paracetamol. So far, are you reassured about our discussion, Emma?
Yeah, but is it mandatory? Like, can I skip it? I'm still a little unsure.
I completely understand, but it's really important that your child gets a vaccine because firstly he
Move
will
on to the
be.
next station.
Thank you.
Thank you. That was good. That was really good. Your performance definitely has been improving a lot. It's a
Thank you
great.
so much, Dr. Rohit. Thank you.
It's great. And yeah, so I think one small thing that I noticed was that you kind of were speaking a lot at the end. So yeah, I know it becomes a little difficult when the time is running out and then you have a lot of things to say. But
Yes.
just make sure that you pause at least once between two sentences. Don't speak more than two sentences in a row.
Okay.
Okay. And
Okay.
then, I mean, it's not just that you become monotonous, it's not just that it's monologue. It's also that you might be missing out on actual patient concerns because they might be waiting to ask something else, but you're not giving them time at all. So just keep that in mind. I mean, in this case, it was fine. I managed to ask whatever I wanted to ask. But one thing that I also wanted to ask was, is it compulsory? And
Right.
you didn't have a time to give me an answer for that. And what is the
Right.
answer?
So I would have said that, if he's not vaccinated and if he gets the infection, that would be more severe. And secondly, I think I talked before about the herd immunity thing.
Yeah, but is it compulsory?
So it is it's not like I don't know if there are some mixed reviews on it. Like some people actually don't get their children vaccinated
By
as well. I
yeah,
don't
so
know. I mean,
by law, it's not compulsory. So I think we can't really
yeah, it's
force.
not.
Yeah, so you
Yeah,
can't
I
really.
can't force them. Yeah.
But yeah, you can. You have to do your best to convince them. But yeah, if they
Okay.
ask you, is it compulsory? Will I get into trouble if I don't take it or anything like that? Make sure you say that. Like, it's not, we can't really force you to do it, but it's very, very important that you do it. Because
Important. Okay.
it's not just for your child, it's, important for every other child around him as well.
Right. Okay.
All right. And yeah, I'll just hand over to Dr. Anne. I think she's done marking.
All right, Dr. Vishri, good job there. We'll
Thank you.
check out the performance as well.
Okay.
Yes, so to add on to what Dr. Rohit said, so always answer the question, what is given to you. So was it compulsory? So that is the question, right? So you are giving the explanation of why it's important, but you're not answering the question of whether it's compulsory. So technically that question still keeps lingering, right? Whether or
Right.
not it's compulsory. So make sure to actually answer the question. But that's another thing on you, because by the end of this conversation, you have to convince them, or you have to
Yes.
argue with them enough to make your point. So always follow why it is important to get the vaccination, right? By also stating the fact that it's not exactly compulsory, by law, but it's advised, you know. So, all right, let's
Okay.
take a look at the data gathering. So,
Okay.
confirmed patient's full name, age, Emma Smith, and 30 years of age, and the baby's name and age. Yes, clarify the reason for attendance by asking the mother to elaborate on her concerns regarding the upcoming vaccination. So this is something that we actually did on purpose to throw you off, to add the autism bit. So usually, since everybody knows that autism is something associated with MMR and it's a very frequent case, but what if they actually ask in this case, right? So don't get
Right.
actually understand, what does she know about it, right? Like, what
Okay.
exactly have you heard, right? Does what
Okay.
this cause MMR, does this cause autism? And then debunk it. Because none of the vaccinations are associated with it, right? Even though, there was a paper trying to link MMR with autism, right? It's actually not associated. So, you can actually be very clear about that fact.
Okay.
So clarify the reasons for attendance by asking the mother to elaborate on her concerns regarding the upcoming vaccination. Explore Emma's knowledge and belief about the vaccination, including what she knows about how they work. So good job in understanding that. So sometimes, so that's the thing, it's an important question to ask to understand whether or not she knows how it works. In this case, she does know how it works. So then you didn't have to go into the explanation of how they work. In some of the other cases, they might not know how they work, right? So bring that back in management. So you will have to explain to them, how it works, right? It actually, about the immunity and how it primes the immunity against all the other infections that can be causing very severe complications later on in life.
Okay.
Emma's knowledge and belief about vaccination and how they work, yeah, we covered that. Ask specifically about her concerns regarding side effects, such as fever, pain, long-term effects like autism, right? So you have to mention that, yes, you will be having some side effects, but they are usually mild and self-limiting, right? Compared
Okay.
to what these diseases can cause you in the future. So these are all the questions you need to understand from her, like, what have you heard? What do you think happens if you get this vaccination, right? Inquire about the baby's feeding, drinking patterns. Ask if the baby has had any health issues recently, such as fever, infection, or hospital admission, which might delay the vaccination process, right? So when are the times to actually avoid these vaccination? You need to understand because he is 5 weeks old, right? And he has the upcoming vaccination in the next 3 weeks. So need to understand if he's actually having any fever, and actually have to warn them that these are the circumstances in which the vaccination will be deferred if he's having any ongoing fevers at that point, right?
Okay.
So
Okay.
definitely inquire about that. Ask about any medical problem, medication, or allergies. Good job there. Partially covered. Gather pediatric history, including developmental milestones and diaper output. This is just to understand the child's health, like a general health of the child.
Okay.
Specific concerns about side effects, vaccine side effects, and administration methods, right?
Okay.
Check for any family history of adverse vaccine reaction or immunodeficiency to identify potential contraindications, right? And then finally, ICE, right?
Okay.
So definitely ask ICE, because if there are any pressing concerns, that will come out. You know, any primary concerns that she definitely wants to share.
I actually was, I kind of elaborated the ice, like my initial questions, and like asking every time, is there anything that's concerning you, anything else that's concerned? So it was like a little elaborated one, lot like a proper ice thing I did in this
Yeah,
case, but
but
okay.
at no point are you asking for the expectations. What do you expect from this
Yeah,
conversation? Right. So
right,
concerns is something, but by the end of the conversation, what do you expect by the time you finish our consultation? What are the
right.
expectations that you have by the time you go home? Right. That's very important for you to address as well. Right.
Yes, yes.
So, all right, management. So I think I'll give you a partial there. Yeah.
Okay.
So, management. Educate about the 6-in-1 vaccine, protects babies against 6 dangerous infections: diphtheria, hepatitis B, influenza, polio, tetanus, whooping cough, by helping their immune system build strong, lasting protection early on in life, right? Explain the concept of herd immunity, emphasizing protection of the whole community, especially those who cannot be vaccinated. So this is when you actually bring about that, you know, sometimes these vaccines are deferred, especially children who cannot develop immunity on their own. So by vaccinating all the healthy children, they kind of get protected in that form, right? And this is called herd immunity, right? That was just a simple word, but good job there. Address Emma's concerns about autism, clearly stating that there is no scientific evidence linking vaccines to autism or neurodevelopmental harm. Offer leaflets about immunization schedules, so good job there. So always 3 things. All by the end of your 2 minutes bell, always start wrapping up the station. At least include these things, which is leaflets, pamphlets, follow-up, and safety netting. In this also, you can actually give safety netting, where you can say that if you notice that, you know, after the vaccination, that the fever is not going down after 7 days, or if he develops any complications, please do come back immediately, right? Or even follow-ups like before the vaccination. If you have any questions or queries, don't hesitate to come back to us. We are here to address any you know, problems that you might have, right? Explain benefits of vaccination, including individual immunity and herd immunity, and the risks of non-vaccinated, example, disease resurgence. Describe common side effects such as mild fever, local swelling, or redness and irritability, and reassure that these are normal and self-limiting. So this is something that is usually expected. So mention it to them that you will be, you know, it is normal to expect these things. So if this happens, it's normal. Normalize that, you know, after effect of vaccination, and tell them that it's self-limiting. It should actually go by its own. Right, but we can always support you if, you know, if it's too severe. We can always support you with you know, a few medications that can lower the fever, right? While UK vaccination aren't legally mandatory, they are strongly recommended and follow a structured NHS immunization schedule, right?
Okay.
This would be a no. I wasn't sure what you're going to say to us, but you started answering. Yeah. So.
Okay.
Explain importance of timely vaccination for individual and public health, and herd immunity. Address consequences of not vaccinating and associated risks. Explain unavailability of separate vaccine and the rationale for combining them. Otherwise, there will be like separate injections that will be given to them, right? So this will all be given in one shot, and there is
Okay.
availability of separate vaccines, right?
Okay.
Formulated that way.
Okay.
Clarify the vaccine schedule, particularly the same vaccine happens to come at 8 weeks, 12 and 16 weeks interval, and mention the update of the 4th. So this is for every child that is born after July 24th, you know, of how they get the vaccination, right?
Okay.
So the 8-in-1 vaccine, if they are born before July 24th, so definitely this child has been born after 24th. So if it is before 24th, then they would actually get the vaccine at 1 year. But the new schedule, if they are born before July 24th, they'll get it in 18 months, right?
Okay. Okay.
Right, that's the fourth dose. So vaccination. So I'll also link out a blog that we have written regarding this vaccine schedule, so you guys can check it out. And also we've linked out the NHS website so that you can go there and check out the real NHS schedule from there as well. All right. So stay the vaccination. Okay. Vaccination. So again, that could also be a potential question, like where will this vaccination be given? So usually they're given in the GP surgery or the local health centers following the NHS schedule by trained professionals. Yeah. Stay the absolute contraindications, like when are these vaccines not given, like in what conditions, right? Anaphylaxis, previous dose, encephalopathy within 7 days of previous vaccination. If any of this happens, and these vaccines are not given again, right? Safety netting, advise Emma to monitor for severe reactions such as persistent crying, high fever, seizures, anaphylaxis sign, and seek medical attention if needed. Offer follow-up appointments to discuss ongoing concerns. Document all details, including concerns raised, information provided, vaccines discussed, and any decisions or deferrals made. All right. Finally, interpersonal skills. So definitely always document these important conversations, right? Always mention the fact that I'm going to be documenting it, right? Interpersonal skills. So covered, we have used empathetic phrase. I understand your concern. It's normal to be worried about vaccination. Always normalize that, question, right?
Okay. Yes.
So good job there. Use simple language and avoid medical jargon. Partially covered, acknowledge mother's concern and normalize anxiety about the vaccination. Summarize discussion to ensure understanding, encourage questions and provide clear, concise answers. Show patience and understanding. Create a supportive environment to make the mother feel heard and respected. So good job there.
Thank you. Thank you so much.
So definitely, I'll have to add, try to keep your answers short and concise, and first answer the question that the patient is putting in front of you, and then give an explanation, because you tend to explain things first, right?
Okay. Okay. Thank you. That means a lot.
To practice this case with AI, please visit TuringMedSchool.com.